All righty, everyone. Good afternoon to those of you on the East Coast. Good morning to those of you here in the Central Time Zone, Mountain Time Zone, and Pacific Time Zone. I'm Dr. Mike, and we're here to talk about how to make your medical exercise training practice referral ready in 30 days. Now, this is day number one. This will be a 30-day challenge, and with each day, we're going to go over a different component or a different task that you need to perform so that you can now start receiving referrals from the medical community. Now, let me make sure you understand. We've been teaching this now for 31 years. We did the first medical exercise specialist workshop back in Washington, D.C. in 1994. That was 31 years ago. And I realized when you get your certifications, you want to get out there and you want to start getting referrals from doctors, therapists, and chiropractors, and you start knocking on doors, and maybe you don't get any positive reception. Maybe you keep trying and you aren't getting anything. I get it. I understand it. Now, folks, I'm a retired physical therapist. I owned a number of sports medicine clinics in the Washington, D.C. area, and I understand what it's like to be rejected by physicians. It's not a great feeling, but let me tell you this. You're not the first, you won't be the last, and this is kind of the way of the world. Physicians are extremely busy, and we're going to clump into this category, referral ready. We're going to say physicians, physical therapists, chiropractors. And for you, the medical exercise professional, I know this is a challenge. So we're going to put all of those medical professionals in one group. When I say physician, I'm actually making it inclusive of all. So I understand what you're going through as a medical exercise professional. It's frustrating. You send reports, you drop off business cards, maybe you do presentations, you give out brochures, and they're just not budging. So over the course of the next 30 days, we're going to ask you to perform a number of tasks that you may think are mundane and boring and aren't important, but folks, I guarantee you they will work. And I've been in the same boat as you as a physical therapist, trying to crack into the medical community to get referrals. And folks, we ended up with 8 clinics that were extremely successful. We sold and were able to retire off the sale. So please, if you would, let me share with you over the next 30 days how to make your medical exercise training practice ready for referrals from the medical community. So let's start today. And one of the most important things I want you to understand is a lot of this information we're going to go over in the class, you can get this in our Cracking the Code manual and our Advanced Medical Exercise Specialist manual. We've put them together in a bundle. You can get the two of them as digital manuals, not as hard copies, but as digital manuals by going over to crackingthecode.net. You'll be able to actually order them there, and they are immediate downloads. And a lot of the things we're going to talk about, forms, guidelines, protocols, templates, letters, are actually in these manuals. So I advise you to get those 2 items. They will be extremely helpful for you. But before we start with the presentation, let's make sure we're clear on your scope of practice. As a medical exercise professional, a medical exercise specialist, you can perform medical exercise training assessments or MET assessments, cardiovascular training, flexibility training, strength training, functional conditioning, balance training, lifestyle education, which is vitally, vitally important moving forward over the next 20 years, aquatic training, and stabilization training. Now, the reason I bring these up, as you go out there and you talk to the medical community, you must know what your scope of practice is, what you can and cannot do. And if you slip up and you say the wrong thing, or you're doing something that is not within your scope of practice, that's going to cause you some big problems down the road. So we always go over that first. And with that, let's get started. One of the first things that you must do is have clarity. Now, I gave you the definition here of clarity: the quality of being specific, focused, easily understood in purpose, communication, and direction. And folks, I'm going to tell you, over the course of the last 31 years, as I've watched the fitness industry, every certification possible has popped up along the way. There are even certifications. I saw one the other day for sleep training. What it is, I don't know, but it's out there. One of the key things becomes, it's not about taking as many certifications as you possibly can to get you ready. It's about having clarity on what you want your practice to look like. And most importantly, the types of clients that you want to work with, the types of referral sources that you want to establish. That's what's important. Now, I know for many of you, you're in the fitness industry. You're not part of the medical community. In the medical community, we all have clarity with regard to what our role is, what our scope is, the types of patients we will see. For you, that will be clients, and the services we provide. For the fitness industry, I understand you try to get as many certifications as you can, and you try to throw anything against the wall to get it to stick that will attract clients. Okay, great idea. but it hasn't worked for you thus far. You need to get clarity. So the idea of establishing clarity evolves to the idea of determining your niche in medical exercise training. Now, folks, in the medical community, we look at our fellow colleagues, whether they're physical therapists or chiropractors or physicians, we look at them from the standpoint of what is your specialty or what is your niche area? That's who I'm going to refer to you. So for you as the medical exercise professional, I know that you want to take in as many medically based clients as you can. Great. But to the medical provider, that looks a little odd. It's a little weird to us. So what we're going to do in this presentation, we're going to talk about narrowing down your niches. And you may have 2 or 3 different niches where you can say, based on my skill, my learning, and the outcomes I produced, I'm good at working with these clients. That doesn't mean you can't see anyone else, but it certainly does mean I'm going to go out and market. I'm going to put my best foot forward talking about managing these conditions so I can now start attracting referrals from the medical community. In the medical community, we don't like vague things, and we don't like something that says it does everything. We realize that to really understand and drill down and do a great service or provide a great service to a client, you have to focus on those areas. Now, you may have 2 or 3 areas of a niche or 2 or 3 niches. That's great. But let's make sure we determine that what your niche is and how you can go about utilizing that niche to grow your practice and attract referrals. So the first thing we're going to do is determine a niche. Let's go through a couple of questions here. Number 1, conditions. What are the top 2 or 3 medical conditions you're most qualified to manage with medical exercise training services or MET services? I'm going to take a second. If you would, think back over the types of medical conditions you've worked with, not the ones you want to work with, but the types of medical conditions that you've actually worked with up to this point. Based on the medical conditions you've seen, which one would you say, if someone were looking over your shoulder, what are the ones you're most qualified to manage? Is it total joint replacements, maybe total hips or total knees? Is it clients with Parkinson's disease or MS? Is it clients with low back pain? Is it clients that have rotator cuff tears or shoulder dislocations? And please, if you would, be specific. In the medical community, when we see our patients coming in the door, yes, we see Mrs. Fletcher, but what we see beyond Mrs. Fletcher is Mrs. Fletcher has a rotator cuff tear or a shoulder dislocation. This is the second one. So she has a recurrent shoulder dislocation. We see the patient, but we see their conditions. That's what we're managing. And when I'm starting to look at that patient and their condition, as I'm starting to refer them, I refer them to individuals in the community that I know specialize in those areas. So again, for you, you can have more than one area of specialization. That's why we ask you, what are the top 2 or 3 medical conditions you're most qualified to manage utilizing medical exercise training services? So if you don't mind, take a second, jot them down. What are the 2 or 3 you're most qualified to work with? We're going to ask you some more questions in a second. I know you say, I want to work with Parkinson's, but have you worked with it up to this point? Okay, so let's talk about currently 2 to 3 conditions that you feel most qualified to manage. This is going to help us determine what your niche is. Next question, your practice. If your medical exercise training practice were operating at full capacity, that means you're just primarily seeing medical exercise training clients. What would your ideal daily schedule include? And when I say include, types of clients, types of services. Would you want to do groups? Would you want to do some paired or combo sessions? Would you want to do all one-on-one sessions? And with those sessions, what would they look like as far as the client makeup? Would there be clients that have neurologic disorders? And what neurologic disorders? Musculoskeletal disorders. What musculoskeletal disorders? Total joint replacements, neurologic disorders. And please, if you would, look at the schedule from starting in the morning. I know for many of you, you start at 6 or 7 a.m. in the morning, all the way until maybe 3 or 4 in the afternoon. If you would, I'm going to ask you to look at that schedule and tell me if you were working at full capacity, that you were seeing the number of clients that you ideally need to see to pay your bills, to take care of all the necessary things in your life, what would that practice schedule look like? What types of clients would be on that schedule? How long would their sessions be? Would they be half-hour sessions, hour sessions? Would you do a couple of groups in there also? So what would that schedule look like, ideally? Now, give you a couple moments to think about that. If you don't mind, jot down a couple things. And at the end of this, I'm going to ask you, after you've jotted down all these things, to shoot me an email at drmike@postrehab.com. So let's go back for a second. We're going to help you determine your niche. First, what are the 2 or 3 top medical conditions that you're most qualified to manage with medical exercise training, that you're most qualified to manage, that you've managed, you've had some success with, you've had some training with? Okay. Now, if you took those clients, those 2 or 3 ideal medical conditions, and you were operating at full capacity, what would your schedule look like on a daily basis? What time would you see clients? Would they be hour sessions, half-hour sessions? What types of clients would you see? Would you do groups, individuals, or would you do combination sessions? What would you do? What would your hours look like? So you need to start getting some clarity on that. Next item, your current skills based on where you are right now, not what you plan on taking in the summer or in the fall or next year, but based on where you are right now, your current skills. What specific skills and outcomes show your ability to manage the medical conditions and the client types that you want to work with? What specific skills do you have, or what specific outcomes have you achieved with clients that now say, okay, I have the skills necessary to work with these clients? Okay. Not too long ago, we had a young lady who went through our advanced medical exercise specialist residency, and she wanted to work with Parkinson's clients. She had no background working with Parkinson's clients, and Parkinson's can be a very tricky condition. There are lots of nuances with Parkinson's disease. Well, she took a class that was taught by personal trainers on working with Parkinson's. Well, she attracted a client that had advanced Parkinson's disease. And she started working with this client, and it became a nightmare. She ended up calling me. And now, as a former physical therapist who was board certified in neurology, I knew exactly what was going on. And we kind of helped her out to back out of the situation and then refer the client on for OT services and physical therapy services. To say this, look at where you are right now. What specific skills and outcomes have you produced? So, what skills do you have right now? And what outcomes have you produced with clients that say you have the ability to manage those 2 or 3 niches that we asked you about in the first question, that you have the current skills to manage those? Now, we're not trying to limit you. We're trying to get you some level of clarity. So what current skills do you have? What specific skills and outcomes do you have that have demonstrated the ability to work with these clients that you've identified earlier as being your niche conditions? Next, future skills. Now, this is what we now start projecting into the future. If you want to work with Parkinson's or MS or total joints, what skills do you need to acquire? What training do you need to manage the medical conditions and these client types? So now we're going to look into the future. So we ask you where you were currently. Now we're asking you in the future where you want to go. So what new skills and training do you need to manage the medical conditions and the client types? So is there a class you need to take? Do you need to learn how to utilize PNF? Do you need to learn how to take vital signs to check blood pressure and heart rate in clients with hypertension or diabetes? Are there some books or other materials that you need to read and review? So what are your future skills? What else do you need? Now, this becomes important because we talked about the niche. Then we ask you, based on your interest, looking at those 2 or 3 conditions that you are best qualified to work with. Then we ask you about your current skills. Now we're asking about your future skills. And we even ask you about what you would want your practice day to look like. So now we're talking about future skills, current skills, future skills. Now with these future skills, now you start to amp everything up. You start to now say, I truly want to work with this. I've demonstrated some skills and some outcomes in this area with these conditions. Now I need to get additional skills. So what are the things I need to do down the road to work with these clients? Now, in many instances, most of our medical exercise professionals say, I just want to work with these clients. I want to get doctors to start to refer. But what we're trying to do here is lay a foundation. What have you demonstrated skills with as far as the conditions that you've worked where you've produced outcomes? What are your current skills? What do you want your practice to look like? And what are the skills that you need in the future? Now we're starting to get a little bit of clarity. And what I'm going to ask you to do with each one of these questions is shoot me an email at drmike@postrehab.com with the answers. Now, the reason I'm going to ask you to shoot me an email, folks, when you actually formulate a thought and you start to walk through that thought, and then you actually put it on paper or you put it in a digital format and send it to someone, now it's real. It now actually is starting to become a real process. And with that real process now, it's amazing. Your brain now starts to think along those lines. So in the past, you just wanted doctors to refer clients to you. You went in and you talked about your great services, which were more fitness services. You talked about how possibly you could help a client restore their level of strength or function after therapy. Great. But the physician wanted specifics, or the therapist wanted specifics, or the chiropractor wanted specifics. Because in our world, everything is about specifics. What skills do you have? What outcomes have you produced? And once you have moved down that road where you understand your skills, you understand the previous outcomes you produced, you're a lot more confident and you now start speaking in terms or in phrases that the medical community understands. And those terms or phrases now start to say, yes, I've worked with these conditions. Here are the outcomes I've produced. And if you've worked with a number of these conditions, you now start to see the wide range of variability in those particular 2 or 3 niche areas. And now you can relate that to the physician, the therapist, or the chiropractor, because they've seen those same nuances as you've seen. So we get you started with the idea of what are the 2 or 3 conditions? Okay. Then we move on to what skills do you have? What skills do you need in that ideal day? And it takes us to the last one, the practice vision. Describe the types of clients you are best equipped to serve with MET and a vision of your practice. So I ask you what your day looked like. I ask you what skills you have already, what skills you need down the road, future skills. Now I'm asking you, what do you want that practice to look like? Ask you about your day, what that day looked like. Now tell me what your practice vision is. Describe the types of clients you're best equipped to serve with MET and the vision of your practice. Now, I'm going to tell you, folks, for the most part, we do a lot of coaching with our medical exercise specialists and our post-rehab conditioning specialists. And when I ask them this question, 9 times out of 10 is crickets. They're not sure. They want to get any and every client that comes in the door just so they can have someone to make revenue. I get it. Generating revenue is important. But more importantly is you've got to have a practice vision. And remember that physical therapist, that chiropractor, that physician, when they started, folks, they didn't have a full waiting room and all the exam rooms are full. I remember when I started in a 1-room closet in a health club, but I knew what my focus was as far as my niches. I knew what skills I demonstrated and the outcomes I demonstrated. And I started conveying those or sharing those with the medical community, and I started getting referrals. With that, every time I took a new workshop, I applied those skills the way I was taught those skills, and I started getting better outcomes. And with that, I started communicating those outcomes with the medical community. And guess what? I started getting more referrals. I grew the practice from 1 closet to 8 offices across the District of Columbia, and it was fantastic. So I've been down this road before. I understand that you want to work with everything and you don't want to miss out on any particular client. You don't want to miss out on any referrals. And you start thinking, well, the doctors just don't like me. They don't want to refer. You've got to get more clarity and get crystal clear on the types of conditions you work with. And it doesn't say that you can't work with a different condition, but if you have 2 or 3 niches and you focus on those 2 or 3 niches, you improve your skill set in those areas, you produce outcomes in those areas, guess what? That spills over into other areas. Because the better I am at these 2 or 3, it may actually start to radiate into other conditions that are similar. And with that improvement in skill set and the outcomes, you become more confident. You start to see a wider range of clients in those niches. And guess what happens? You just get better and better and better. So with that, one of the key things becomes get clarity. Clarity is vitally important. Now, we're going to do these through 30 days of tasks, items, skills you need to develop so that you now can start to attract referrals. So the first thing is get clarity and determine your niches. Now, with that, we're opening our new revised medical exercise specialist network. It will launch on May 22nd. This 30-day challenge is designed to move more individuals into our MES network. And the first thing we want to do with that network is help you start to get referrals from the medical community. So every day for the next 30 days, except Sundays and holidays, I'll be right here with a live broadcast. We will go over what you need to do along those 30 days to now, at the end of those 30 days, to start getting referrals from the medical community. It's not just simply I've got a certification. I drop off a brochure with a doctor. I send him or her a referral pad and drop off some cards. And maybe once in a while, I'll send a referral update or a progress report. No, it's a system that you have in place. And with that system, it allows you to become more confident. It allows you to grow into the practitioner that you want to be, and then to start to radiate that out to medical professionals in the community. So if you would, please join us tomorrow. That's right, tomorrow, Saturday. We'll do this tomorrow at 11 a.m. Central Time. That'll be noon Eastern Time. And we're going to do the second day and talk about this cracking the code in our webinar series for medical exercise professionals. So if you would, thank you for joining us this morning. The recording for this will be ready later on this afternoon. And probably sometime in the next few days, you'll get an email from us inviting you to join our MES network. Now, the MES network will have 3 tiers. If you're already a network member, don't worry about it. You'll be invited in at one of the higher tiers. But this revised network will be available for all medical exercise professionals. You'll get an invite to the free level, and please join us. And this will be one of the amenities at the free level, the 30-day challenge as to how to move your practice to be physician referral ready or healthcare referral ready within 30 days. So thank you for joining us.